In today's Health Watch, we are talking about fluoride in drinking water. President-elect Donald Trump's pick to lead the Department of Health and Human Services, Robert F. Kennedy Jr., says fluoride can cause health problems and wants it removed from our drinking water. CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, joins us now to discuss. Good morning.
Good morning.
Good to see you. All right, so Celine, fluoride is added to about 72% of community water supplies in the United States. I've never had a cavity, and I also do not have, never had a cavity in my life. Never had a cavity in my life. And I know sometimes part of it could be genetic, but I also suspect that the fluoride that's been added to the water has been beneficial. And I don't have any of the health risks that Robert F. Kennedy Jr. is suggesting we might have. So what's going on here?
Fluoride is added to the water because it helps repair the enamel. And so we have been adding fluoride to the water really for the last 70 or so plus years because we have seen over time that it helps to reduce cavities among both adults and kids.
But there are some areas that don't have fluoride that have chosen to take it out. What are the results that we've seen happen there?
So there are areas that have stopped adding fluoride. So I think it's important to distinguish. There are some places they add fluoride. There are places where there are naturally occurring levels of fluoride. Where they have decided not to keep adding fluoride, we have seen rates of cavities go up.
Well, you know, RFK's made these claims. What proof does he have about these issues, whether it be arthritis or neurodevelopmental issues?
So this is where the numbers really matter. So as with many things, the dose of fluoride matters. The CDC recommends that where there's not naturally occurring fluoride in the water, that the levels be supplemented up to a level of 0.7 milligrams per liter. So the numbers are important here. The EPA and the CDC recommend no higher than 2, but that's not legally enforceable. And then there is a legally enforceable max of 4. But in most communities across the country, we're seeing much, much lower levels. At 2 or above, it's less than 1% of communities that have those kinds of levels. And again, it's naturally occurring. It's not because it's being added. Where you have levels over 2, there may be a risk of some issues with IQ. There's some hints of that from data from China and Mexico. Again, less than 1% of Americans are exposed to those levels, naturally occurring. And at levels of 4 or above, then you may have some issues with bones.
Well, thank you so much for giving us the facts. Dr. Celine Gounder, thank you for being here.